On-demand PrEP means taking pre-exposure prophylaxis tablets, and specifically Truvada. It's important to know that Descovy has not been studied yet for on-demand dosing, but it's taking PrEP tablets only around the time of an exposure. And that differs from daily dosing. But what we do know is that taking 2 tablets at least 2 hours prior to an exposure leads to really great concentrations in the anal rectal tissue. And for that reason, on-demand dosing is something that is indicated really only for cisgendered men who have sex with men. It's not indicated for any vaginal exposure, and we really don't have the data right now for cisgender women, and we also don't really have the data surrounding risk for intravenous drug use. So on-demand dosing is this 2-1-1 schedule taken around the time of a sexual exposure. And it's important, again, noting from this diagram that you take these 2 tablets at least 2 hours before, ideally 24 hours before, one 24 hours after, and another 48 hours after. So again, it's 4 tablets around the time of an exposure. The IPRGay study was like the first really study that showed that this on-demand strategy is effective. So the study design was that they randomized men sex with men at risk for HIV to either active PrEP or a placebo PrEP. And the medications that they used was Truvada. And what they found is that those that received the active PrEP arm, that they had an 86% reduction in risk compared to those that took the dummy or the placebo pill. And in fact, there was only 2 infections in those that were in the active arm. And really in both of those infections, what had happened was that the participants actually had very low drug levels, so they were not adherent. So if we actually factor that in the IPRGay study, it was 100% effective in terms of averting HIV infection. So I think that was the first study to really demonstrate that this on-demand dosing schedule can be highly effective, and you minimize the number of pills. And then that kind of led to the Prevenir study. And the Prevenir study enrolled about 1,600, again, men who have sex with men. And they gave them this time the option, do you want to go on daily PrEP or do you want to go on on-demand PrEP? And about 55% chose the on-demand. So they did the 2-1-1, and the others did the daily PrEP. And what they found is that in both arms, there were 0 HIV infections. So really, both of these strategies were highly effective in averting HIV infection. So again, I think what we're seeing here is that we have more options for patients. Although daily PrEP is still recommended, this on-demand gives options for patients that either don't want to take a daily pill, are concerned about side effects, or maybe just don't have sex that often. I've had patients of mine, cisgender women and transgender men, that have come to me and said, hey, is on-demand dosing for me? Is it something that I can try? Is it as effective as in men who have sex with men? And unfortunately, at this time, it is not recommended. And the main reason for that is because these drugs take longer to accumulate in the cervical vaginal tissue. So really, on-demand dosing is not recommended because it may not be as effective as with anal rectal exposure. So really, for cisgender women and for trans men, we still recommend daily dosing. Now, it doesn't mean that there's not going to be other options in the future. We know that long-acting injectables are going to be coming for pre-exposure prophylaxis, and there are other antivirals that may have alternate dosing for like different populations.